Dr. Pena, could you describe how poorly controlled diabetes affect your eyes?
As far as diabetes, unfortunately, like the panel has said, this is very prevalent. It's high incidence of diabetes here in the Valley, and with Hispanics, we're the majority. So that's the problem. The problem is that the glucose molecule is very big. It takes up a lot of space in the actual vessels. So trying to get into the tissues where all the nutrients are needed, it's a problem. So with all the microcirculation, with the foot, with the kidney, and of course with the eye. So what happens then is that the choroid, which is the back of the eye, because we have the whole eye, the front part of the eye, obviously it's avascular with the cornea, because we need that window to see. If they had any vessels, you couldn't see. So the back of the eye is the one that is in charge of having all the blood vessels, all the nutrients and everything. And when you have diabetes, well, you have what we call neovascularization. You try to form new blood vessels, and unfortunately they're very fragile, they're very leaky, and you start having some exudates and some hemorrhages and things like that in the back of the eye. The first thing is that it's gotten a lot better over the couple of decades. I've been here for 25 years already. But at first it was like, oh, you're diabetes and you haven't been seeing anything. So now the primary care physicians and everybody else have been very good as, oh, you're diabetic, we're going to send you to the ophthalmologist to get screened, to get checked. Because unfortunately, you may not get any symptoms until you can't see anything. Doc, I can't see anything. Well, wait, and you look in there and it's a big mess. Well, why didn't you come before? Well, because it doesn't hurt. And I could see, so why even do that? So we've gotten a lot better of making sure that we screen patients, and I see patients in my office. Well, but doc, I go get my eye exam every year, and I change my glasses and things. Well, that's nice, but if you don't have a full dilated fundus examination where you actually check the back of the eye, and a lot of optometrists do that, very, very good. But some are just, you go in, you get checked, and then that's it. You get your glasses, but that's about it. The back of the eye, if this room is the eye and we're looking that way, well, that would be a big piece of a big window in the front over there. Well, all these walls would be the retina, and all these walls would have blood vessels. And right smack in the middle here, we have the macula or the fovea, which is when we see 20/20. Well, when the patient comes in with full dilated fundus examination, that's what I check. And if that little spot right there is good, they could still be seeing 20/20, not a problem. I don't know why the doctor sent me. Well, because you have diabetes. And I can find a lot of hemorrhages and exudates and a lot of problems all around. It's kind of like they're gaining. It's kind of like the circle wagons and stuff. Because if this part is fine, you can actually see fine, but you're already having a lot of diabetic retinopathy all around, and that's where the problem is.